our next group, I'm so thrilled to introduce Art and Global Health Center Africa. They're absolutely a fantastic NGO based in Zomba, Malawi. And what they do is harness the power of arts to nurture creative leadership and ignite bold conversation as actions in communities that promote healthy, open, and active people who are free to be who they are. So they have 3 core programs, which are Make Art for Sustainable Actions, which use participatory film and theater to inspire bold conversations and actions for some of society's biggest challenges, such as HIV, gender-based violence, and nutrition. Then they have the Umunthu program, which uses the arts to catalyst reflection and discussion, providing a platform to address issues of stigma and discrimination through the lens of Umunthu, a Pan-African concept of humanity. And then they have Students with Dreams Youth Leadership Program, which provides college students with training, mentorship, and seed funding to develop innovative projects that creatively address pressing issues. So I'm going to turn over to Roger Peary. Roger is a personable, analytical, and results-oriented health rights activist currently working as a program manager for the Art and Global Health Center Africa. He's leading in development and implementation initiatives aimed at creating inclusive and equitable health service for LGBTIQ people and other minority groups in Malawi, dedicated in advancing global health issues, human rights, policy advocacy, and very passionate about Umunthu, the philosophical concept of humanity. He has a bachelor's degree in social development and a diploma in business administration. Roger, the floor is yours.
Thank you so much, Achisomo. Good morning, good afternoon, and good evening to all of you joining us. We are going to take you through a presentation like workshop on Umunthu, the philosophical concept of humanity, which I think Achisomo has already alluded to. So in this session, our presentation this afternoon is entitled Umunthu, using indigenous philosophy and visual arts to promote joyful access to health for LGBTI people in Malawi. So in this session, we will explore how Art and Global Health Center Africa is using Umunthu, the Pan-African philosophical concept of humanity, through artistic methods to instill the perspective of humanity, that's Umunthu, in health service provision, particularly the inclusion of LGBTI people. It will bring together different perspectives on the joy that can be found when stigma, discrimination, social exclusion, and other barriers to health access are overcome. The interactive session will use different art forms, including sharing footage of creative activities, and also mostly from the Umunthu workshop, and also facilitators will share their experiences using arts to open conversations and also sensitive topics in different contexts. We will also invite Umunthu participants, a healthcare worker that has been involved in the project from the onset, and also an LGBTI person to share their experiences around Umunthu in healthcare profession. So allow me to share my screen. Can you see it? All right, so the workshop outline, we will take you through a brief introduction of Art Law and Umunthu program, and also interactive activity to sample the workshop methodology, and also I will share a brief findings that from media and evaluation, and also Umunthu participants presentation. So at Art Law, we harness, So at Art Law, we harness the power of the arts to nurture creative leadership and ignite bold conversations and actions. We envision a world where communities are open and active, and people are free to be who they are. So, sorry, I just jumped into it. So Umunthu, as I think it has already been introduced, we use the arts to catalyze reflection and discussion, providing a platform to discuss contentious human rights issues that have an implication on health. So I'm handing, we are going to sample a little bit of what we do in our workshops. Mostly, we believe that when people are given a chance to express themselves and also to speak about contextual solutions to their contextual problems, people take ownership on the implementation of such. So what we try, or what we strive to achieve in our workshops, is to have people to be free and honest, and also to open up to discuss about issues that concern them, especially those that have an implication on health. So I just want to hand you over to Deloy to take us through a sample of the workshop activities that we do in Umunthu workshops. Over to you, Deloy.
Thank you, Roger. As Roger has already said, I'm Delroy White. I'm also working at ArtGlow as the Umunthu Extension Project Officer. So at ArtGlow, or say at Umunthu and ArtGlow as a whole, we use participatory approaches, as already said. An example of the participatory approaches would be the pairs game, which is used as an icebreaker and an introductory game. So I'm going to, for this activity, I'll need four volunteers, 2 pairs. It's better if both the pairs know each other. So one pair that knows each other and another pair that knows each other, at least a little bit. Do we have any volunteers? We can interact through the chat box, or you can unmute. Anybody? Okay, so it's, and Victoria, and okay, so it's Chisoma, Katrina, Victoria. Anyone else? Okay, we can use the 3 of you. So what I need you to do, if I'm assuming that all 3 of you know at least a bit of about each other, right? Like all 3 of you. Victoria knows something about Katrina, Katrina knows something about Chisomo, and Chisomo knows something about Victoria, right? I'm assuming, right?
I think I know Chisomo. I have never met Victoria, but maybe Victoria knows Chisomo as well.
So perfect. So Katrina, I'd like you to introduce yourself as Chisomo. Okay?
Okay.
Chisomo, I'd like you to introduce yourself as Victoria. Okay, Victoria, do you know something about Katrina?
No.
No.
Okay, a little.
Okay, a little bit. Cool. It doesn't matter.
From today's presentations, maybe. Yeah.
That's perfect. Don't worry. So, Chisomo, I'd like you to introduce yourself as Victoria. Victoria, you're going to introduce yourself as Katrina, and Katrina, you'll introduce yourself as Chisomo. We'll start with Chisomo. So you put your video on and introduce yourself as Victoria.
What's happening? Okay, yeah, my video is hidden. Hi, everyone. My name is Victoria. I have studied West African literature. I'm absolutely fabulous and very sociable and easy to get along with. And I'm really passionate about making change in my work and providing spaces and really doing stuff differently. And yeah, that's who I am.
Okay, thank you, Victoria. How are you, Victoria?
Oh, wait, is that still me?
Yes, you're Victoria.
Oh yeah, yes. I'm well, but confused.
Okay, let's go on to Katrina. Katrina, we'd like you to introduce yourself as Chisomo.
Okay. Hi, my name is Chisomo, and you all had better know me, because otherwise that means you've been asleep for the last day and a half. So my name is Chisomo. I am a force of organization. I really am someone you can rely on to make things happen. I've got the most infectious laugh, and a really great sense of humor. In general, I'm a pretty passionate person. I'm passionate about people. I'm passionate about the continent of Africa, and I'm passionate about well-being. And I didn't tell you, I'm based in Scotland right now, but originally I'm from Malawi.
Okay, thank you, Chisomo. How are you today, Chisomo?
I'm really good. It's been a long, it's been a long day and a half. I've been doing a lot of work behind the scenes, but I'm feeling energized by being amongst everybody.
Thank you. Okay, so Victoria, you're last. A few seconds to introduce yourself as Katrina.
Okay, we're going to try. So, hello everybody. My name is Katrina, and I love art. I am a very artistic person, and I love to, express ideas and connect to people through my work. I like warm colors, and because I think that it touches people also in warmer ways. And yeah, that's what I like to do.
Thank you, Katrina. How are you today, Katrina?
I'm great, thank you.
Thank you, thank you. That was brilliant. That was excellent. So I just want we've already heard from Chisomo that she felt confused. But a question that will follow up in the reflection of this would be, how does it feel to be someone else? How does it feel to be different? So we just want one word from Katrina, one word from Victoria. We heard from Chisomo that it was confusing. Victoria, how does it feel to be someone else?
I don't know, limited. Because I don't know very much about the other person.
Okay, so you felt limited. Okay.
Yeah.
Katrina, how did it feel being someone else?
I felt I really had to be very present. Like I had to really engage with what I knew about Chisomo and kind of use my powers of observation and recall. Because it's a little nerve-wracking also,
So it's nerve-wracking. It takes an active effort to be someone else, right?
Yeah,
but it doesn't. But all three of us would agree that we would not cease to exist if we had to wake up as someone else. Victoria, today waking up as Katrina, you would not cease to exist, right? You'd still be a human being.
Yes.
Yes,
but we'll still find ways around it.
You'd still find ways around it, exactly. Yeah. So this game will normally lead us into what we call the who's and the what's. And the who a person is the human being, the inner human being that they are. That human being that connects us all, the common thing between us all. Before you were a doctor, before you were an organizing dynamo, before you loved art, before you were poor, before you were rich, you were first a human being. And the what's come after that. So when you're born, we're all born as human beings, and then we are all differentiated from that. So the what's come after that to say this one will be Victoria and this one will be Katrina. And that's how we differentiate. And that's how from the humanness that we are, we become a bit different to each other. But at the end of the day, we are all human beings. So at Umunthu and art as a whole also, we believe in the interconnectedness of human beings and believe that in participation in our workshops has a greater impact than as compared to the traditional lecture methods of delivering workshop and delivering information. So that's about the pairs game. I'd like to share another game, which we call the balloon stomp. The balloon stomp is a small activity.
So maybe we can just show them a video
okay.
of what we do.
Oh, yes.
To break the ice, yeah.
So pairs game is an introductory game. I'll show you a quick video about another icebreaker that we use in our workshops. So this one is it's an energizer / icebreaker, which makes people get comfortable around each other, makes people free to bring us together a little bit, to make them feel free to express themselves. Sorry, some technical difficulties.
Mm-hmm. So that's it.
Okay. So I hope you saw the icebreaker. That one is what we call kansaru. Someone runs around showing people a cloth. So the next activity, the participatory activity that we use is called the balloon stomp. As you can see on the screen, it's when people take a balloon that's tied to a piece of string and they tie it to the non-dominant leg at their ankle. And it's a competition based game where people run around trying to burst their friends' balloons or other people's balloons while protecting their own. Right, so I'll just go on while you're watching the video. At the end of this game, and being participatory, we ask the participants to reflect on the game and how it connects to day-to-day life. And most of the times it comes out, people say that as human beings, we like to have what's good to be ours and not someone else's. So we're selfish like that. So in parts of the reflections come out to say also that the bad that you do unto others, you don't do unto them alone, but you do unto yourself. So the concept of karma, that what goes around comes around. So you should be actually try and be good to everybody, be kind to everybody, because the good you do to others is the same as the bad way. It will come back and to you. So the good you do unto others, it comes back and it's the good that you do to you as well. And the balloon stomp also teaches us that harboring negative emotions and negative feelings towards people doesn't help achieve much. But if we come together, be loving, and come together to achieve one goal in unity and interconnectedness, it achieves more positive and makes the society go on. So we've seen that our participatory approaches have had a huge impact. So right now I'll pass it on to Roger, where he's going to show us a little bit of our midline evaluation and the impact that we've had as Umunthu. Thank you.
Yeah, thank you, Deroy. Yeah, so on the first day, we discussed about Umunthu and also how Umunthu interplays with discrimination, social exclusion, marginalization, and also some other social vices that as barriers to access for minority groups, especially LGBTI people. So on the second day, we have guest speakers. That includes a medical speaker and also a legal speaker and also an LGBTI person that come in and share their personal experiences and also fill in gaps in knowledge that usually that are usually in response to what has come up from the workshop. And on the third day, participants come up with action plans. They start with personal pledges of what how they are going to use the learning that they have gotten from the workshop. So that's one of the games that we use in the workshop. It's called birthing game, but we're not going to talk much about it. So the midterm evaluation tried to find out about the impact of the project. So the main question was that has the project influenced desired results? So midterm findings that suggest that the workshops improved care workers' awareness of the discrimination being faced by minority groups, including LGBTI people, and the negative impact this has on their health. Also, those are the figures, like up to 76.58% more healthcare workers recognize the negative impact discrimination has on health access after attending the workshop than before the workshop. And also 14% of health service providers said they would treat an LGBT person before the workshop. But the rate rose up to 87.7% after the workshop. And at the follow-up workshop, that happened 6 to 9 months later, 76.1% of the participants said they would treat an LGBTI person. So the concept of Umunthu remains a relevant contextualized device to understand LGBTI health access through a rights perspective. That's one of the findings that the the midline evaluation unearthed, and also with 71.4% of male health service providers showed improved attitudes at the end. Only 56% of females improved their attitudes, and only 33% of females improved their attitudes in Kodagoda. So there was that discrepancy on the improvement of attitude between male health service providers and female health service providers, and the figure was even lower in Kodagoda. So we came up with several assumptions, but one of the assumptions was that maybe it could be to do with the age of the health service providers, or maybe religiosity. So we asked the external evaluator to dig deeper and find out if age or religiosity was an influencing factor. But interestingly, there was no relationship that was unearthed. What we found out was even a completely different finding from our assumptions. The finding was that the more religious one is, the more accepting one was as well to change their attitudes towards providing health services to LGBTI people. Then on the age of care workers, our assumption was that maybe the older you are, the less accepting you would be, but the finding was also different. The older care workers were, the more accepting they were also. So those are like findings that like proved our assumptions wrong. And going forward, I'm not going to take you through all the findings, but I just want you to hear from the participants of our workshops. So we have an LGBT person who would want to share about their experiences, and also how do they describe finding joy in accessing health services after the Umunthu workshop, and also we are going to hear from the participant who is a health service provider who went also through the workshop. So first, to share their personal experiences after the workshop is LGBT person. He's going to introduce himself.
Hi everybody, my name is Patrick Aligala. I'm based in Fiji. I'm an LGBTI member. So I'm going to explain how the Umunthu program has helped me in terms of accessing my health facilities around here in Ginji. Before the Umunthu program or the Umunthu project, it was kind of difficult for me to go to like government hospitals to access the health facilities because due to stigma and discrimination that we're facing around here. But after the workshop, that is, it is kind of a joy giver because most of the health care workers they have changed their perspectives towards the LGBTI community because they have now understood what it is to be an LGBTI member, and that we're just humans, just as any other person around, and that if they they discriminate against us, it makes us shy not to go to the hospitals because we are afraid that maybe they will disclose to the whole communities that this particular member is a LGBTI member. So after the workshop now, I would say I'm a happy person because I can go freely to the hospital and access the healthcare facilities. Yeah, thank you.
All right, that's Patrick, who is an LGBT person, benefited from the project. So let me just explain a little bit of the workshop methodology. After the initial workshop, okay, sorry, there's a technical issue. Okay, thank you, Daryl. Okay, so after the initial workshop, whereby we engage health service providers and also a few community leaders. We usually come back and invite health service providers to a convergence workshop whereby they meet LGBTI people within a particular area to discuss about contextual issues that are acting as barriers to health service provision. So they come to the workshop and also discuss about health access disparities with the particular health service providers in their own area. So they usually like form or exchange contacts and also form relationships whereby LGBTI people in that area would be able to access particular health service providers within the area. So Patrick was one of the participants that attended the convergence workshops and also that established personal relationship with health service providers. So with me is Priscilla, one of the health service providers who attended both workshops, the Umunthu workshop and also the convergence workshops, and also who established and now is providing health care to LGBTI people. So let's hear from Priscilla. Over to you, Priscilla.
Thank you, Roger. Hello, everybody. You have already introduced me. Before the intervention of Umunthu program to Unjinji District Hospital, there was a lot of difficulty that was the impact between the gap between the generalized people. But by more part of it, it was about of information on illegal environment. We was not aware of it or we were afraid of it due to cultures, due to religious, and due to traditional belief in our different settings of different faiths. But the most part of joy given to us as health workers after the coming in of the intervention of Umunthu project in Unjinji District Hospital, there's a great impact that is still existing on the ground. Many we have the good relationship between the health workers and the LGBT community peoples. They are able to share information between them and us while confidentiality is there, kept well, no any harm to them. And also there is a collaboration that is still existing in the ground and it's ongoing between the different sectors. For example, we are receiving different cases that need collaboration of multi-sector departments like social welfare, police, health. We sat down as a table in order to achieve one goal for that scenario that has happened to us. And also we have a great joy to us that is mainly of liberation of services. The LGBT people are able to get the effective, and quality service of health service to us. We can have a case in morning handover and we can share the case notes and give them the different stacks of how to improve and how to work hand to hand with our colleague that was on the ground. So with the incoming of this project, there is a great impact to us and we have a great joy that there is no discrimination between them and us. Thank you.
Yeah, thank you, Priscilla. So we strongly believe that when participants are involved in the process, when the participants discover their own problems and also discuss about contextual solution, there is that ownership of the implementation process. So what we usually achieve after the workshop is the realization of the impact of not providing health services to certain sectors of the society, and also the personal pledges that particular health service providers or individual service providers make to start providing service or to start looking at provision of service through the lens of the Umunthu concept of humanity. And so in conclusion, I would say that African culture and philosophy are diverse, evolving, and also subject to interpretation. It is possible to use African belief systems, specifically those focusing on interdependence and tolerance, to evoke reflection and also encourage greater tolerance of LGBTI people and other minority groups, thereby removing areas of anxieties and achieving joyful provision and accessibility of health services. Confrontational approaches that we've been using before usually lead to a backlash, which entrenches people more firmly in their personal beliefs. So that's all about our brief presentation that brought you this afternoon. So we're opening the floor for questions.
Great, thank you so much. Oh,
yes,
I've been fumbling with my.
You may go ahead.
Yeah. We've got.
Hey guys.
Yeah, sorry.
I don't know. Oh, okay. Hey guys. Thank you so much, Roger, for your presentation. And I think I do get to see you around because we stay pretty close. I stay by the housing flats. So I had this question that cultural beliefs are not in themselves easy to alter. And so how best and effectively do you intend to break such beliefs in your work without harming or imposing your goals onto people, because all persons are human and entitled to their opinions and ideas? So that was my question.
All right. Thank you so much, Augustine, for your question. Actually, Umunthu is both cultural and also it conforms very well with religion. So what we do is not like imposing what we know or what we believe, but we usually facilitate the learning through them exploring the concept of Umunthu and also its interplay with culture and religion. When they find that commonality is when we take them through what it is like to provide services with Umunthu, or what it's like to provide services without Umunthu. So they usually bring forth the issues that usually come about when they provide services without Umunthu. Like there's discrimination, there's social exclusion, and there's marginalization. And also when we dive deeper into discussing about the implications of health, like one of the major findings of a certain study that we usually share is about Kangaudi study in Malawi. There was a Kangaudi study that was conducted at Likoma Island that wanted to find out about human sexuality, like the behavior. And at the end of the study, it was found out that almost everyone who was sexually active slept with everyone on that island, meaning that I can contract HIV and AIDS or any other infectious disease from my brother, from my mother, from my sister, from my pastor, and from anyone, but indirectly. It means that if I trample upon the person that is so close to me, or I discriminate against the person that is so close to me, in the long run, whatever they are going through will find its way back to me. So that kind of a thing that the health service providers realize that they are at a place where they could take each and every case that is presented to them as an opportunity to end it there and then. That kind of realization bring the message home. So they start believing that whatever they do or whatever decisions that they make have got implications on the general society, not only on the victim. Thank you.
Thank you.
Thank you.
Carla, your question came next.
Thank you so much, actually, but just before mine, sorry.
Yeah, I was just going to say quickly, I think one of the beauty about addressing this through Umunthu is it dispels the idea that homophobia is a personal belief. It's an adopted system that was violently passed to us. And I think that one of the things that Umunthu is very good at doing is using our traditional customs and addressing exactly how we got where we are. In the discussions yesterday, we talked about that kind of epistemic transference of customs and beliefs that we now uphold as our own. And it went through a very, very vicious 90-year process to begin to rescript gender roles. So I think with Umunthu, it has the capacity to actually say the ideas that we espouse as personal beliefs are inherited systems that come from a colonial formation. And I've always found it more important. I think that's why the work you're doing is so important, because it's asking people to engage with their traditional customs. And I don't have any problems of actually ascribing anything to the contrary as homophobia. So I think that what we need to be doing.
You're muted.
Yeah. So we have, am I unmuted? Okay, yeah. So I think that we have a system of beliefs and ideas that guided our cultures. And we're working against new systems that have come into place. So I just wanted to kind of affirm your team and to say that this is important work of understanding not just tolerance, but the roots of intolerance. So I just want to pass to Carla.
Thank you so much. Carla, your question comes next.
Thank you. Just to build on Chisomo's point, I mean, I think, the one thing we know pretty much globally is that sexual orientation is not a choice, but homophobia is. So, where the work is most required is in where there is homophobic responses. And as Chisomo's articulated, the idea of recognizing the commonalities of humanity allow us a way to see each other that in the past perhaps has been artificially denied to us. My question, going back to the group, is I was interested in the commentary that there are sustained relationships that are maintained afterwards. So, often with workshop events, it's like people do the workshop and they go away, and then it's kind of a nice thing that people have experienced, but that capacity to build longer and more far-reaching consequences is significant. I wondered if there'd been any feedback from healthcare workers who maybe did come to a shift in their engagements or their understandings of homophobia or of discrimination or stigma, if they've been able to kind of take that work forward in work environments where they may hold a minority view on that. So, somebody's gone through this process, they've kind of rethought a thing and understood about healthcare provision in a certain way, then you go back to work and you may be one of only a few people who hold that view or are trying to provide a better service. So I'm just, and then, I'm sorry, I forgot the name of the healthcare worker who spoke, spoke about going back and having a new idea of that. So I just wanted to know, is there any indication about how, those relationships continue or how, or what it's like to go back into a work context where your view may have changed, but other people's may not have? I think there's the question. Thank you.
As of now, because staff always come and always get transferred out. So we have a continuous habit that if we have new staff that is employed in a certain district, we always do on-job training, whatever the programs are done on that district to sustain and make it effective of the program. So every staff who is enrolled in King District Hospital is actually now doing on-job orientation concept of Umunthu project, so that this program should be more effective to everybody. There should be no discrimination. The data should be accumulating, not going down.
Thank you.
Okay, thank you. I hope your question's been answered, Kara. Okay, before we go to Rory, there was a comment saying, I just wanted to say that I believe this is a very good initiative because I personally know people that belong to the LGBTI community that have been afraid to go to the hospital in their community because they don't get the attention like all other people. In other words, they're sidelined. That's very, very, very true, Grace. Rory, you had a question?
Rory, you're on mute.
Hi, sorry. I was just interested in the slides where you said that you found that older healthcare workers and more religious healthcare workers, there was an association between that and being more accepting of LGBTI people. I'm wondering, maybe it's a bit unfair, but I was a bit surprised. And I'm wondering if you have any hypotheses on why that might be the case, or if you can expand on just expand on that association generally.
Yeah, thanks so much, Rory. I think it was just an assumption. We believe that Umunthu concept or philosophical concept of humanity is well aligned with religious beliefs, like it believes in love, it believes in interconnectedness, and also coexistence and togetherness, and also the appreciation of the respect of diversity and everything. So I think more religious service providers found it a little bit or more aligned to their already existing beliefs, perceptions, and also practices, kind of. So that was just an assumption, but we are yet to find out more about why that association is there and why is it that strong.
Can I just say something briefly?
Thanks so much, Gola. Hope I've answered the question.
Oh.
Yes, go ahead,
Hello?
Helen, you can add.
Oh, sorry. Something I just wanted to clarify on that last question is it wasn't that the more religious people were less homophobic, but they had more of a shift in attitudes before and after the Umunthu workshop, if you see how I mean. So it's not like that they started and ended with more positive attitudes, but there was a greater shift, which wasn't something we'd imagined.
I hope your question has been addressed, Rory. Any other, okay, there was a thumbs up, thank you. Do we have any other questions, comments? Before we hand back over to Roger to close. Right. So I think we're done with our question and answer session. Back to you, Roger.
Thanks a lot, everyone, for joining our session this afternoon. I don't have much to say. I'm looking at the time, I think we are we're only remaining with seconds, so I'm handing it over to Chisomo.
So much. I'm sitting here fumbling with the video. Thank you so much. It was absolutely wonderful. I mean, it's really important to know the ways in which people are navigating taboo issues and how they're using traditional knowledge to tackle them. So thank you so much to the entire ArtGlow team.